of the most basic things?
Yes, it does, and that's why what we're now doing is working with the local councils and the local NHS who've arranged these placements into these facilities to make sure they're now taking the necessary steps to assure us that they are safeguarding the welfare of people living in these institutions, and also reassuring relatives as well that safety and welfare and quality are the key considerations.
You say that, but for the Panorama programme, perhaps we wouldn't have known this. I mean, this is a failure of regulation as well, isn't it?
There are a number of things we need to look at very carefully, and the CQC would have been the first to admit that they let people down when it came to Winterbourne View, and that they need to learn lessons from that. But it's not just about regulation, it's also about companies like Castlebeck understanding right from the very top, right to the very bottom, that they have a responsibility for delivering good quality care for the taxpayers' money that is being entrusted to them and the individuals who are being entrusted to them.
The trouble is, if they fail, and other companies as well, the public need reassurance that there is somebody watching, and this is not just being done underneath the radar with people who have very little voice actually going unheeded.
Yes, and that's why Winterbourne View and the work that Panorama has done has demonstrated that the system does need fixing, that we do need to make sure that the local NHS and local authorities that are involved in sorting out these sorts of placements do understand what they are doing when they make those placements, that they are really commissioning services that deliver good quality results. The trouble with this set of facilities seems too much to have been about palming these individuals off into unsatisfactory care, and that is never acceptable. That's now been revealed, and as a government we're determined to make sure that that doesn't happen again.
Just a final quick point, because I mean, it is half of the homes that they've looked at here, but it is only one company. Given what has been found just with one group, is it not perhaps for government to look at this more broadly and perhaps have an inquiry right across the board?
Yes, it is, and that's why when Winterbourne View was exposed in the way that it was, I already have ordered the necessary work to be done by the CQC. They will be carrying out inspections of 150 other facilities around the country, run by other companies and other organisations, to satisfy them and us that they are delivering better quality care, excellent care indeed, which is what I think people should expect. After all, we are spending millions of pounds in these organisations, and they are entrusted with the care of some of the most vulnerable in our society. And that's why we need to make sure we build on the work the CQC has been doing over the last few months.
Well, that's Paul Burstow, the Care Services Minister. Let's talk as well to Anthea Scully, who is the Director